Is it possible for dementia to be reversed or slowed down or, dare I say, cured?
Depending upon the cause of dementia, it could be cured or slowed down or at least help. Sometimes the dementia is due to a vitamin deficiency or a thyroid disorder. If it's something like that, the dementia can literally be cured with replacement of the vitamin, treatment of the thyroid disorder, etc. More commonly, what we can do when somebody has, for example, Alzheimer's disease or dementia with Lewy bodies or vascular dementia is we can turn the clock back on the disorder. And the studies show that if I give one of my patients a common memory medication like donepezil, brand name Aricept, I can actually turn back the clock on their memory loss by 6 to 12 months.
That's crazy.
So what I mean by that, so I can actually make somebody's memory like it was 6 months ago or maybe even a year ago. Now, the important thing to recognize is using these types of medicines, I cannot stop the clock from ticking down. So when I see that same individual back in my clinic 2 or 3 years later, because the clock is still ticking down, they are going to be worse off when I first saw them. But they're always going to be better off on that medicine. They're always going to have that 6 to 12 month boost compared to how they were before.
That is really interesting. But they have to continue using it.
They have to continue using it. And in fact, if they stop using it, what happens is they'll lose that 6 to 12 months worth of memory function in 1 to 2 weeks. So if I start someone on this type of medication, which helps to boost up a level of a chemical in the brain called acetylcholine, and they have a good response, and we see that 6 to 12 month reversal of symptoms, then, I really want them to stay on that medicine sort of forever. And this is a very common thing that happens. We spoke earlier about my imaginary patient, Bob.
Mm-hmm.
So let's say, Bob comes to see me and he says, Doc, I was really good at, managing all of my bill paying until the last, 6 months ago. And now, it's much more difficult for me to do it, and I'm starting to pay bills twice and miss some altogether. If I put Bob on this medication that can turn the clock back 6 to 12 months, what happens is Bob comes back to say to me, you know what, Doc? I can do my bills on my own now. I'm able to do it again. And then I continue to follow Bob, and I see him a year later, and he says, I'm having that trouble again that I was having last year. Mm-hmm. Because I don't have a medicine that can turn the clock back, 30 years or 20 years or even 5 years, but I can turn the clock back 6 to 12 months, half a year to a year. But Bob needs to keep taking that medicine. And even when Bob is back in the same place, he still needs to keep taking it, or he'll lose function if he stops. So it's not a miracle drug, but it definitely can help. It means it helps keep people independent, helps to keep them in their own home, helps to keep, them from driving everybody crazy by asking the same question 100 times. So it really can help. And then with these new medications that have just been FDA approved, now, for the very first time, we can actually slow down the progression of the disease. So now I can slow down that ticking clock of Alzheimer's disease. And the way these new medications work is they remove these amyloid plaques from the brain. And once you remove the amyloid plaques, it can't stop the deterioration, but it does slow it down. And as you can imagine, for a medication that slows things down, the earlier one takes it, the better. And I can even foresee something in the future that when one turns, say, the age of 60, maybe even 50, you'll get a screening test to see if you're building up these amyloid plaques in the brain. So even before there's any brain damage and even before you have any symptoms of memory problems, Bob goes to his doctor. Doctor says, Bob, now that you're 60 years old, we're going to see if you have any amyloid in your brain. So I want you to go down and get this blood test. I think there'll be blood tests in a few years for this. And, Bob sees his doctor back in a couple of weeks, and the doctor says, Bob, the bad news is you do have some of these amyloid plaques in the brain. But the good news is I'm going to give you this medication. It's an injection, and this will help to remove those amyloid plaques to prevent you from getting Alzheimer's. That's what I see as the future. So where we are today is we can't prevent it. Today we can slow it down. But in the future, I think we could even prevent it.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.